Welcome, everybody.
Good morning.
Good morning. I'm checking to see if we have quorum. And we do have quorum. Okay, we're starting this. We are streaming and we do have quorum. So Madam Co-Chairs, you may start the meeting.
Okay, good morning. Welcome to the Committee of Care meeting. Let's call this meeting to order at 9:31. My name is Michelle Jameson with US Vets, and I am the co-chair with the committee along with Stephanie Smith with Native American Connections. We will now start roll call. So Brandy Mead will call each committee's name and ask you to introduce yourself with you and your organization. Brandy?
Great, thank you, Madam Co-Chair. Vanessa Carthel. Richard Cruz. And don't forget to take yourself off mute to introduce yourself. Richard Cruz. Daniel Davis.
Good morning.
Good morning. Kathy Dinolfi.
Hi, Kathy Dinolfi, and Elise.
Good morning. DC Ernst. DC, I know you were on earlier. Are you on?
Sorry, it just takes me a minute to get my mute undone. Present and accounted for.
Thank you. Michelle Jameson.
I'm present and with US Vets.
Thank you. Wendy Johnson.
Wendy's here.
Anne-Marie Johnston.
Good morning, Ann Johnston here from Community Bridges.
Thank you. Laura Magruder.
Good morning, Laura Magruder with Maggie's Place.
Jennifer Page.
Good morning. Jennifer's here from Mercy Care.
Thank you. Aaron Rain.
Good morning. Aaron Rain from the City of Mesa.
Good morning. Nikki Ramirez. Nikki, are you on?
I see here it says that she's still connecting to audio.
Okay. Can come back to Nikki. We'll come back to Nikki. Ty Rosenstiel.
Good morning, everyone. My name is Ty Rosenstiel. I'm from Solari Crisis and Human Services, formerly Crisis Response Network.
Thank you. And Chayla Schuster.
Good morning, Chayla Schuster, Community Solutions.
Thank you. Sarah Sims. Let's see Sarah on. Laura Scott-Nicky. No Laura today. Stephanie Smith.
Stephanie Smith from Native American Connections.
And Craig Tripkin.
Craig Tripkin, Central Arizona Shelter Services.
Great, thank you. And let's go back. Nikki Ramirez, are you here?
I am. Nikki Ramirez, Chicanos for La Causa.
Good morning. Thank you for joining us. Did I miss anyone?
Vanessa Carthel from ABC.
Great. Thank you for joining us, Vanessa. Anyone else from the committee? Okay, I would like to introduce Nikki Stevens. She is with MAG. She's our new Regional Homelessness Program Manager. Nikki, I believe you're on. Would you like to say hello to the committee?
Hi, everybody. I'm sure most of you know who I am. Nice to see you.
Great. Thank you for joining us. We're thrilled to have Nikki as a member of our team.
Thank you.
All right, back to you, Madam Chairs.
Thank you, and welcome, Nikki. So thanks to all participants. We need you to mute your phone or your computer when not speaking, and please do not put your phone on hold. For all participants, we ask that you identify yourself when speaking. We will be reminding people to do so throughout the meeting. So I have a procedure change to mention regarding the chat feature in Zoom. We operate our community meetings in full transparency, giving the public access to community meetings, materials, and discussion. The public cannot view the chat comments, and as a result, we are disabling the chat feature in all community meetings moving forward. If you need technical assistance during a meeting, please contact the helpline at 602-452-5095. And again, that number is 602-452-5095, or contact the MAG staff assigned to the meeting. We appreciate your understanding and helping to maintain the transparent discussions for the benefit of the public. So now we will move on to Stephanie for the call of the audience.
Thanks, Michelle. Please note that members of the public were given an opportunity to submit written comments relating to this meeting to azmag.gov/comment within 1 hour of the posted start time for the meeting. Any written comments submitted will be included in the record. Were there any comments posted, Brandy?
Thank you, Madam Chair. No, there were no comments received.
Thank you, Brandy. And we will move on to approval of the consent agenda.
So do I have a motion to approve the consent items? I need you to please identify yourself when making a motion.
Craig Tripka, move approval.
Thank you, Craig. Do I have a second?
PC Ernst, I second.
Thank you. So staff will proceed with a roll call.
Okay, Vanessa Carthel.
Aye.
Daniel Davis.
Aye.
Kathy Dinolfi.
Aye.
Michelle Jameson.
Aye.
Wendy Johnson.
Aye.
Anne Marie Johnston.
Aye.
Laura Magruder.
Aye.
Jennifer Page.
Aye.
Aaron Rain.
Aye.
Nikki Ramirez.
Aye.
Ty Rosenstiel.
Aye.
Shayla Schuster.
Aye.
And Stephanie Smith.
Aye.
Thank you. And the motion passes.
You left me out.
That's what I was wondering.
I had you down for making the motion. Is that correct?
Okay, sorry.
Okay, that's okay.
That's awesome. He just wants to make sure he's included. Double. We got you, Craig. All right, thank you. So the motion passes. So now we will go to the, we're going to switch from the item 4 to 5 as first. So we will go, Stephanie will announce the agenda item number 5.
So next, I would like to invite Daniel Davis and Jamie Taylor from Shared Housing Institute to present on the Maricopa County Regional Shared Housing Initiative.
Good morning, everybody. Daniel Davis from ULM. I'm very excited to be presenting on this new effort in our community. Many of you, this will be the first time hearing about it, but it has been in the works, kind of in the margins for a little while. And right when we are able to kick it off, we wanted to get it into the community's hands to be part of the planning process and helping lead this effort. So a real quick, setting the context, and then Jamie Taylor will take over to present more in depth on how to best implement shared housing practices in our community. But shared housing is, in essence, multiple households living in the same unit. And while this has been in the conversations on the margins in our community for a while, there is a unique opportunity right now to, there's a lot of money flowing into our community. So Maricopa County's Human Services Department has agreed to fund and to help lead this effort. So shared housing, it gives an opportunity for better access to affordable housing for, if you think about it with like 2 singles or with 2 youth, but other communities have found success with almost every subpopulation. So veterans, and small families. If you think about, one example is we have a couple single mothers at our family shelter who want to move in together. How do we best support them in that? What does the lease agreement look like? What does the roommate agreement look like? We have 2 single women at Holly Women's Center, and they want to move in together. How can we help set them up for success? Or even if somebody just wants a roommate, how do we help them find somebody who will be compatible with them long term? So Maricopa County will be leading this effort directly with the Shared Housing Institute. And I just want to be clear that while UMOM has been interested in this for a while and helped secure this initiative for our community, I specifically, and we will not be the sole leaders of this. We're going to have a leadership team, which we'll talk about in a little bit, and I will be participating in that. But yeah, I think I'm going to hand it over to Jamie for a little bit, and then I'll close us out after her presentation.
Great, thanks, Danielle. So it's exciting to be working back and with Phoenix. I worked with some of you folks and quite a long time ago, actually, on rapid rehousing. My own background's in public health and doctorate in public policy, but focused on rapid rehousing. So I spent a lot of years focused on data and the use of data and rapid rehousing improvements and data-driven decision making. And now I'm doing shared housing 100% of the time. And it actually started in 2018, the shared housing piece for me from SAMHSA, our Federal Substance Abuse Mental Health Service Agency. They hired myself and my colleague to do a white paper environmental scan of how is shared housing working, specifically for people in homelessness experiencing serious mental illness. So we did a deep dive in 2018 into where are these programs, what are they doing, what does it look like? We created a white paper and a great PowerPoint. We presented at the National Alliance in 2018. And we realized it was going to go nowhere unless we brought it out into a toolkit. And so we got funded by Hilton Foundation, Funders Together for San Diego, and also Salt Lake City, and started a process in 2019, which is developing a toolkit, deeper environmental scan, and deeper toolkit on what actually works. And as we went forward, we got to understand, working with all the system leaders, that if we were going to bring this forward out to true system impact, we needed to bring something out that's actually a system change framework, creating shared housing as a norm across the system. And so the last year, I started the Shared Housing Institute because it felt like, one, I didn't want to work for people anymore. I wanted to do this one thing and not have to answer to the other things people telling me to do. And we did a very deep, almost a year in the state of Connecticut and also in the city of San Francisco. We're still in San Francisco, developing a system-wide framework, and we've incorporated and expanded in an amazing toolkit. We had a national conference that some of you came to, and we are kicking off a national learning collaborative with 4 different geographies. Maricopa County is one of them, San Diego is one of them, City of Philadelphia is the other, and San Bernardino County. And so we're right now giving you a quick overview, kind of a framework to sort of give you a broader context, as Daniel said, to the shared housing contextual framework. But really what we learned is, in order for there to be a system change, we have to dive deep and we have to create it and marry it to your system. You have to adapt the tools into your guidelines, your resources. And at the end of the game, you have to actually have shared housing coordinators that are going to continue this, that are going to ground it and continue this. So we're at the beginning of the process, kicking off a learning collaborative next week, actually, which is really groundbreaking and very exciting. And Maricopa County is a part of that. So this background, we can go to the next slide, is really to just quickly bring you into giving you the context of what we're standing on. And what Shared Housing Institute is working with are really partners from very, very, very mature, effective shared housing program leaders across the country. And they come into all the trainings as a part of it. And what we've done is really adapted the best, a compilation of the best practices into systems. The systems themselves then take those best practices And all of it is grounded on client choice, housing first, and really effective community building. Next slide. So shared housing is many things. We're going to see in another slide how shared housing actually plays out. One, it's a norm across our markets. My kids are adults. They both, one Boston, one New York. They're in shared housing probably for a very long time to afford the kind of housing they want in expensive cities. It's not a norm in our homeless service system. It's not a norm in the HUD program. It's not a norm in the Housing Authority framework. And we're focusing on shared housing as it shows up as permanent housing, really when two or more unrelated people are living together and they have their own room and they share common living spaces. Each tenant has its own lease, and they also have the choice to stay or leave shared housing at any time. So ultimately what we want to do is really maximize out. You right now have units where there's 2 or 3 or 4 bedrooms that are not getting utilized as a exit out of homelessness because the shared housing norm isn't across our country yet. But our goal is to make that. And after 12 weeks, it will be something you'll all be hearing and thinking about with tools to access in your own system. Next slide. Benefits are why we do it. Why do my kids do it? For lower costs, also for community, to live with their friends and live with the people they want to be with. And it's going to allow actually more choice for our clients for preventing and ending homelessness and obviously move into homes sooner. So we have a lot of, not a lot of research evidence, but we have a lot of anecdotal evidence that of course it's affordability, number one, but the number two, the community connections is real. And that for the most part, people, especially with COVID and where we had to shrink our communities, our supports, but people find in shared housing that they actually work out relationships that support them, which is what we all need for our own self-determination, right? That groundedness of connected with community inside our home and also as a bridge to the external community around us. Next slide. So the goal here is to create it as a norm, that it's not something special. It's actually something offered out. It never replaces someone who doesn't want shared housing, is never forced into shared housing. They could be in PSH straight up, or there could be PSH as shared housing. That it's an option in there in the high cost housing markets, which Phoenix is one of them. I don't know about the rest of Maricopa County. It actually, if I was moving into Phoenix right now, would I be able to afford my own rent? I'm not sure. A lot of professionals in high cost cities are also moving in with shared housing, and we need to adapt that into our own markets. So it's really bringing that culture and that framework and the toolkits. And now is the time we have unprecedented housing assistance dollars, and rapid rehousing is our greatest opportunity to use it as a bridge to bring shared housing across the system. Next slide. So this is real quick, just the different shared housing models. We're really, again, focused on the landlord as the housing provider or the homeowner who doesn't live in their home. It doesn't mean that home share models are not good. They're very, very good. They're not, we have not seen home share models that are just targeting the homeless population, but we support that if it's done effectively. We support collaborative housing that's also people even in a shared bedroom. It might be focused on rehab. If that's done with client choice, that's very positive. There's a lot of new construction happen, especially in California, with shared housing models, and we promote that. We bring out speakers around that. But our main work is really around the landlord with multiple units that have multiple bedrooms. And that could be through a master lease process or straight tenant, straight rental, holding their own lease. And you could see the list of funding sources here. And we get into that. We get into all of the HUD rules and regs. HUD released in January, actually, the PIH, the Housing Authority gods, there released their document on HUD and shared housing, promoting it and telling that it's acceptable. And it has been acceptable, actually, but it's not become a culture. We have a Housing Authority training being developed, funded by Salt Lake City, and that's going to come into play. We'll be able to bring that into our work towards the end if it's developed by then. But there's this whole wave is really bringing in a new thinking in our work so that it actually, again, becomes a norm. Next slide. So we found with effective shared housing programs from our environmental scans, from our work, which is ongoing, that there's no standardized fidelity way of doing shared housing. That what works is in fact effectively client choice at the center. And you're going to see data in the next slide, the returns to homelessness rates, and they're very, very low. And that's because these programs doing effective shared housing are housing first programs. They would do great work no matter what. They happen to be in high cost housing markets in Orange County, California, in Fredericksburg, Maryland, in Palm Beach County, Florida, in Los Angeles, in places in Connecticut. These high cost housing markets drove them to create these programs years ago, just organically. And that return to homelessness rate is really based on their housing first culture. And that means many things to us now because it's kind of gotten filtered down, but putting client choice at the center and holding that, doing whatever it takes to keep people stably housed. But what's really important is understanding that shared housing works for all populations. It's clearly not for everyone. That's a different statement, but it works for all populations, and people with serious mental illness and substance use issues can be successful in shared housing because, again, it's client choice, housing first at the center, and skilled staff who have that capacity. What's important is with shared housing, you've got to have a focus on client mediation and housing stabilization, and you've got to figure out some landlord procedures so landlords know what to do. It's really upping your game with your landlord engagement. We have a great part of this project that's with Home Inc. that's also going to bring the Home Inc. culture in their landlord work into shared housing with Mike Shore. So that's a wonderful parallel with this project. Next slide. So these are impacts, and these are not all of our stellar exemplar programs, but you can see that it's both successful with both PSH and rapid rehousing. And again, these return to homelessness rates are very low and very consistent with effective shared housing programs. These are people that have been out at least a year. Next slide. So client choice, client choice, client choice at the center. Throughout our 12-week training, that's also going to be a theme in all that we're doing. And again, we're going to build those, we're going to strengthen those building blocks that are already in your system that support client choice in order for shared housing to be done effectively. Next slide. So the need for Maricopa County, I just pulled it out yesterday. You already know this, so I just need to put it in there to market. Like, it seems like you have a very expensive real estate market that's going in the wrong direction for access for renters of any income level, but especially people at risk of or in homelessness. Next slide. So real quick, HUD shared housing. We're going to go to the next. We have a deep overview. The next slide. That goes into all of the HUD rules and regs for all of these programs. All of them support shared housing. None of like right now, we just got this emergency housing vouchers, EHV, that came out. And they actually have $3,500 attached to each voucher that can be spent on landlord incentives, getting landlords in, which is really critical when we're talking about shared housing and how you bring that culture into landlords. And it's an opportunity, and we need to bring that and get that into guidelines, which we're creating now that can go out nationally, that shared housing is possible with these new vouchers. Shared housing is possible with eviction prevention dollars that are out there through ERA. And it's definitively possible with emergency solution grants, which is, we have a ton of money from there, right, on what we're doing. So this is based on, go to the next slide, based on what we've done with a HUD. She actually is a lawyer. She was a HUD field officer, works as a HUD TA provider, and developed the training based on the CFR rules, based on the language. And again, HUD themselves, the PIH HUD, Housing Authority HUD, came out with guidance in this in the end of January on shared housing. And that's a part that will be incorporated into what we look at. Next slide. So what we're doing in our training is looking at the effective components of shared housing. We're going deeper into each of these components, and we're adapting. We have a lot of wonderful guides, resources, tools that we bring out, and we're supporting you in each of the site teams to adapt those tools into your process, and then adapt the training tools of which we have, but we're not going to come in and do the training. We're supporting each site to create their own, utilizing all the resources that we have. And then at the end, there'll actually be a deeper dive. If this is going to go system-wide, there has to be a deeper dive into all the shelters, diversion workers, prevention, and it becomes a cultural norm that way with the infrastructure. Next slide. Client messaging is one of the key topics. It's one of those pivotal topics in how we talk about it to ourselves and then how we talk about it to clients. And next slide, we spend a lot of time on this framing, which is really a good framing on problem solving. It's really adapting deep listening skills. This is never used verbatim, but we do a lot of interactives in our trainings also, so that people are starting to talk, not just take it in, but actually starting to practice how they would talk about shared housing. They're also needing to identify what their own barriers are and learn why it is effective and how it works. Next slide. Fundamentally focusing on the budget and the client's own goals and the realities that they're facing to reach those goals is fundamentally the best tool and the best training for frontline staff. Because in Connecticut, for instance, we have 3 strong shared housing programs, and Hartford is none. That Hartford's length of time in shelter is 200 days. And they have a very, very strong Housing First program. They have a lot of money. They have it's 3,000 people a night across the entire state. Those are smaller numbers, but they don't have a culture inside their shelter when housing options come up. The people could say, no, I don't want to go there because this, or this. And the shelter workers don't have the capacity actually the sophistication to really sit down with the clients, talk about, look, this is your budget. This is your options here. Shelter's not an option. You're in shared housing here. And this is why this choice works for you. In the trainings, we have the effective shared housing programs coming in, training and guiding you on this. We have toolkits and you practice it across your system. And then you actually bring it and train more again across your own system. But it's really a pivotal point here is where and how you talk about shared housing with the client once your system is set up, so the client actually can access the housing options in front of them. Next slide. Housemate Match, we've learned a lot in the process of Housemate Match. We're going to go ahead to the next slide. We're going to bring forward really what Connecticut's done, because Connecticut's brought it both into their HMIS system. You can go to the next slide. They're tracking shared housing interest through HMIS, and then they're tracking the exit question. Next slide. And most importantly, they took a process. They're dividing up their process. If there's income, if a client has income that's over 1,000 and they're interested in shared housing, they're matched with other people interested in shared housing and moved into rapid exit. There's a lot more people in our systems who have income, and getting that identified and moving them into rapid exit with shared housing is one of the effective ways. And then if they don't have income, in both cases, it's asking always, is there someone they want to live with first, supporting that? And if not, there's a house pairing process. Next slide. And originally, the idea of like what that would look like was kind of like Match.com, right? And we collected from all sites their housemate pairing survey tools. We would work with sites to pick the ones they like best, an amalgamation of it, and then thought about how they could pair people up. And you know how, I don't know how many of you have been in Match.com, but what that process is, I don't know what the percentage is of actually successful matches, but it's a process, beginning of a process. And in our housemate surveying in Connecticut, the housemate pairing survey, the original one they came up with was 24 questions. Then they brought it to fair housing, which is key. And fair housing said, you can't ask this, you can't ask that, you can't ask this, you can't ask that. And so they were left with asking a much smaller window and utilizing this for actually motivating discussion with the housemates that are paired. So you can see here the top 3 deal breakers here. And you can go to the next slide. This is the back end of the smart sheet. So they're doing it across the state. When people have an interest, the clients are filling this out. And then they have keynote shared housing coordinators who do the pairing. And they're pairing people by what they think are, whether they reside in the same region, what their gender preferences are. There's a really respectful way of asking that question in this survey. And also if they have no conflicting concerns. but they're bringing people together to meet once they're paired and talk about those deal breakers. So it's not like, bam, you're in. It's like, here's some deal breakers. How would you mediate loud noise with each other? And in that process, people, for the most part, decide to live together, but they may decide this is impossible for me. And that happens before they're matched in housing. The next slide. We also have tools. Once people are matched, we have housemate agreements, which are contracts between roommates, which is really important, where they make visible between themselves what they're agreeing upon. That becomes a platform for future conflict resolution. We also have conflict management toolkits. We're creating actually an 8-hour training for the clients themselves in shared housing to do across each other. They can get a certificate, they can put it on their resume, conflict management training. It's the coolest thing I've done in this whole project. I'm so excited. But that comes in also when people are housed, because we want to help build the capacity to deal with conflict as it arises in any of our households, with all of us living with people. Next slide. And again, just setting up the rules, expectations, making it clear, giving people tools, all the tools that we can, actually giving people tools, supporting them in this process. And it's driven by the client once they're in housing, and also supported by the case managers for rapid rehousing for as long as they're in that support or PSH. Sometimes though, these are clients that might be in prevention and you're giving them tools and you may not be professionally case managing them. So we have toolkits for all of these scenarios, which we are excited about. Next slide. And we really support landlord engagement. You can quickly go through this. We're again working with Mike Shore. You have phenomenal landlord engagement networks there. Next slide. We're going to bring all that we have on the shared housing outreach piece to that effort too. So that's going to up the game for landlord engagement in your Maricopa County. Next slide. And measuring change. This is the key here, right? If we don't actually know who we're housing in shared housing, how will we ever know what we're doing and who's doing what? So right from the get-go, we're going to work with the leaders on a few things. One of them, next slide, is getting the HMIS indicators built in from the beginning, ideally shared housing interest, plus the planning exit data. So both, we're going to bring that in. We're going to work with leadership to make that happen as a platform across all the sites we're working in. And we're also going to support the development of the skill sets and the monitoring of that in a way that has an infrastructure that carries it. Next slide. It's Connecticut's data points, which we talked about, and they built it into HMIS. Next slide. So there it is. This is a National Shared Housing Learning Collaborative, the first cohort. We have, again, 4 sites. This is what we're going to be doing. Very, very exciting. I'm so happy Maricopa County is one of them. You have great leadership there. You have great examples to share back to other peers. And it's really going to move forward in an accelerated way to increase your housing options for people exiting homelessness and also the prevention of homelessness. So excited to get going on it. Daniel?
Thank you so much, Jamie. As you all can see, we're thrilled to bring in an expert on this. This is something that has been going on and that our community members experiencing homelessness have asked for or are already doing. And if this is going on in our community, we obviously want to be the experts on it. So we're happy to be partnering with, like I said, Maricopa County and a few other people helping this initiative to get this off the ground, and to add this as a long-term resource to our county's toolkit. But since this is, as you could see, this is a system-wide effort, HMIS, everybody, I'm sure Ty's like, could have told me before this meeting, but since this is impacting an entire system, I wanted to propose that a lot of this effort is shepherded by the committee. When I look at the governance charter for the committee and the general COC structure, a lot of the provider initiatives and trainings are to be managed or facilitated by the committee and its various work groups. I was hoping to have some time to open it up for discussion today, but I know we have a ton to go over with the strategic session, the next agenda item. So I'm going to postpone it. I'm going to give everybody some time to think about it and kind of chew on it a little bit. But I have kind of 2 prompts for you. One is we're putting together a leadership team, and this is going to be 4 to 5 individuals that are cross-sector, that are committed to seeing this through over the next couple of years. So really hitting it hard up front and then keeping a pulse on it as time goes on. And then second of all, what we think and how we can engage this to be a long-term effort that lives in our COC instead of maybe spread throughout various other regional coordinating entities. So that's for your consideration. Thank you very much for your time, everybody. And Jamie, thank you so much for making time to be here and bringing in this presentation. It's awesome. We're really grateful for your expertise. So thank you all.
Okay, looking forward. See you next week. We kick it off.
Guys, that's exciting, right? I mean, we're doing it with like 4 other counties. It's the first time we're ever doing something like this. It's awesome. We're going to be learning from and learning with other communities. So
Thank you, Jamie and Daniel. Any quick questions for Daniel?
I think that would be good to open up for discussion, and maybe that's something that we can put on the next agenda item just to go over that. So yeah, it's very exciting.
All right. All right, well, I'll hand it over to you, Michelle, for the next agenda item.
Great, thank you. So we are going to go to agenda item number 4, the Regional Homeless Strategy Portfolio. So Amy St. Peter will present on the Regional Homeless Strategy.
Great. Thank you so much, Madam Chair and members of the committee. It's a pleasure to be back with you to talk about this really important work. Your expertise in this space is critically important, and we want to make sure that we are leveraging your insights on this, your questions, as we shape how we might strengthen the regional efforts that are present throughout all of our communities. So the purpose of my presentation then today is to get your feedback on the strategy portfolio that was recently released last week. We had our very last strategy session, and so the portfolio now includes a lot of the material that you've seen previously in terms of the vision, mission, goals, including the strategies themselves. We've also included some optional tactics that communities can consider, that we as a region can consider as we're implementing this important work. Next slide, please. So just to ground us again in that main focus for all of these efforts, we're keenly interested in reducing the numbers of people who are experiencing homelessness right now, increasing access to homeless assistance programs throughout the entire region, so increasing that geographic footprint, and then strengthening the safety net for all people. And so that speaks to prevention as well as that racial equity lens, which is so critical. Next slide, please. These are the main topics I'll be covering during today's presentation. I'll be joined by Ty Rosenstiel with Solari Crisis and Human Services, and we'd love to have any questions or comments that you might have in mind throughout this presentation. Next slide, please. So as we're digging in particularly to that context, that's really critically important because all of this work is grounded in your local realities. So in what's going on right now in our communities throughout the region. So it's important just to take a moment and look at that. Next slide, please. Of course, as you well know, our numbers of people who are experiencing this critical issue has been increasing, and it's been increasing for the past 4 years. This is not unlike many other regions and communities throughout the country. Last year, of course, or for the last point in time count that was done, for the first time ever, we experienced having more people living out on the streets than who were living in shelters. That's different from what we've seen in previous years. Next slide, please. And you are well aware of all of these different reasons that people give for the factors that have contributed to them losing their homes. You can see that family disputes and economic reasons and evictions are among the top cited, as well as substance use and mental health issues to a lesser extent. Next slide, please. So when we look at where the need is occurring throughout our region, we can certainly look at where people are reported as experiencing homelessness right now, but we're also looking at who's that at-risk population. So who are the families, who are the individuals who are just barely holding on to their housing? We're using calls to 211 as one kind of proxy for estimating where the at-risk population might reside. And as you can see, to varying degrees, that at-risk population is present throughout the entire region. Next slide, please. And this becomes even more apparent when we look at the population who's paying more than 30% or more than 50% of their income every month on housing. We know from research, from experience, that this makes them more vulnerable to losing their homes, particularly if something happens like losing their jobs or getting into a bad car accident or experiencing higher than normal medical bills. And particularly when we look at the at-risk population through that definition, truly, we have people throughout the entire region who are living at risk of experiencing homelessness. Next slide, please. We were asked to update our data on evictions, keeping in mind that there is a moratorium in place that is likely to be lifted very soon. And you can see the dramatic decrease in evictions when those moratoriums have been in place. And keeping in mind that those moratoriums will be lifted here very soon, we are anticipating having even greater numbers of people experiencing homelessness as a result of those evictions being carried forward and with that moratorium being lifted. Next slide, please. So when we're looking at where the need is in terms of people who are experiencing homelessness right now, as well as an at-risk population, it is truly present throughout the entire region. When we look at where are the homeless assistance programs as defined for the purpose of this conversation as the shelter and the housing units, we have very, very good programs of varying scales. Some are smaller, some are larger than others. They're pretty well clustered though in just a few communities throughout the region. Hence the focus on expanding that geographic footprint of homeless assistance programs. We know that people can stabilize more quickly when they're closer to home. And so even if someone has lost their housing, they might still consider that community to be their home. That's where they work, that's where their kids go to school, that's where their family friends are, that's where their faith community is, and that's where their medical care is. And so we're looking at opportunities, expanding those opportunities through a full range of different solutions that could be put into place throughout the entire region. Next slide, please. So just as a reminder, this has been our timeline since we started ramping up these regional efforts last fall. Our efforts kicked off with initial research and outreach that has continued and been very extensive. This is where we are right now with that blue circle in terms of taking a look at those regional strategies and seeing if any changes need to be made to those and how we might be able to gather support for those regional strategies that would enable us to pivot then to developing that tactical implementation plan. Next slide, please. This is a summary then of all of the efforts that we've undertaken since the fall to strengthen the homelessness infrastructure throughout the region, primarily through extensive outreach and research, also being able to provide ongoing tools such as Hand Up, the homelessness assistance and needs data for unified planning tool that is available to you. I believe you've had presentations on that in the past. That's how we're making these data available to you on an ongoing basis to assist you with your local and agency specific planning efforts as well. And that's in addition to, of course, all of the good work that's gone into the development of the regional strategies and the corresponding planning elements around that. Next slide, please. So the regional strategies, we're excited to be able to share these with you. You are the first committee to receive this presentation, and we wanted to start with you to make sure that we had the benefit of your expertise moving forward. Next slide, please. So originally we looked at 300 different strategies that were being implemented or considered at the local level. We then looked at what were the best strategies nationally, and then we distilled all of those down into 14 different high priority strategies that we see as the region's most viable opportunities to be able to move forward in this space. We've organized those 14 strategies into the 5 categories that you see in front of you. These were developed on the basis of that extensive outreach and research. Next slide, please. These are the 14 strategies. They have been refined even very recently. We are thankful to receiving feedback from different stakeholders. Homelessness is not created by any one sector, nor can it be solved by any one sector. So each of you offers a really unique perspective on what it will take to move forward in this work and be able to demonstrate progress. So these are not the only things that need to be done, but these were estimated or evaluated to be as having the most priority then for moving forward quickly as a region in each of these areas. Next slide, please. The next steps then include hopefully approval of the strategy portfolio that will help us know that we're moving in the right direction, and then we'll be able to pivot into the implementation plan development, which will be occurring hopefully this summer. We are making some final changes to that Hand Up tool based on your feedback and the feedback from others. We are hard at work this morning. Some of us were working through the night, and we're all back at it early this morning to continue looking at the projections of the additional shelter beds, housing units, and diversion and prevention services that are needed. We are collecting a lot of great local current cost data, and we appreciate you. We've been reaching out to providers to try and collect some of that data, so we know that we're responding to the market and being able to develop some correct and accurate cost analyses. And then on the basis of those projections, that cost analysis, we'll be developing a few different scenarios then that are based on analysis and policy position. So we're eager to be able to share this with you next month, and hope to have your assistance and your support in this activity throughout this whole process. Next slide, please. This work absolutely would not have been possible without many, many people really jumping in. And I mean, just jumping in like full speed ahead, right? I mean, just really contributing significant amounts of time, expertise, their feedback. We want to thank you as one of our primary partners in this work. It's been critical to us to be able to leverage the expertise of the continuum of care, and particularly of you as direct providers. We need to make sure that this work resonates with you because you're working with people on a daily basis. And so we're excited to be able to work with you on this and with all of our partners who have assisted throughout this process that started last fall. Next slide, please. So for your feedback, I'd like to transition over to Ty Rosenstiel. He has been an absolute hero in all of this work. The expertise that he's been sharing with us, the hard work that he's been dedicating to this has really, really been deeply appreciated, and is helping us to really be able to undertake much more sophisticated analysis than what we would have been able to otherwise. Also do want to acknowledge and thank Sapna Gupta from our policy team here at MAG. She's been the point on all of the research, and she's been working very closely with Sarah Murley from Applied Economics to be able to take Ty's great work and move that forward then, particularly with the scenario development. So at this point, please, if we could transition over to Ty Rosenstiel, and he can share with you the information. Do want to call your attention to my contact information. I'm guessing that you have probably received emails from me already in the past at some point, but if you have not, here's my email address as well as my direct phone number. It'd be a pleasure to hear from you directly after this meeting, as well as receiving any input that you might have to offer during this meeting. So that concludes my presentation. Before we switch over to Ty, are there any quick questions before we make that transition? Okay, let's go ahead. Jeremy, if we could please bring up Ty's presentation. And Ty, you're here and ready with your nice new Solari background. Excellent purchase background. Very nice. Jeremy, do you have Ty's presentation, or Ty, will you be sharing your screen? It looks like we have your presentation. All right, Ty, I turn it over to you.
Thanks a lot, Amy. Good morning, everyone. Again, my name is Ty Rosenstiel. I'm the Director of HMIS and Database Resources at Solari Crisis and Human Services. The piece that I wanted to go over today was sort of the nuts and bolts of how the numbers are getting produced to be able to support the regional strategies that Amy just described. Amy went into sort of the 30,000 foot view. I would say that my presentation is more the 500 foot view, being able to say what are some of the nuts and bolts that are going into this to be able to share opportunities that we're looking for feedback specifically. One of the pieces that was really important to me as we were looking at doing this analysis was really trying to ensure that we were using accurate and local data for all of this analysis. And Amy talked about that from a cost projection perspective, that we're looking to get costs from individual agencies. And I'm sure many of you probably have gotten those cost requests from our team. But another piece of that is also using local data for the person projections to be able to say, when we want to see a reduction in unsheltered homelessness, how would we actually do that? What would be the metrics that we would use to do that? How can we do that on a live basis? So this committee has had presentations from me previously around the by name list and the Built for Zero process. And really, I just want to clarify that the baseline data set for the information that we're going to be using in the regional strategies will be the most accurate and current data that we have available to us. Sometimes that might be point in time data, but most of the time we're actually going to be looking at more live HMIS data, specifically our by name list. So I wanted to put forward just a slide around what our by name list is and what it is not. This is generated from HMIS, includes all programs and all people. It includes sheltered and unsheltered. We have definitions around when to take people off of the list. This is data that's generated weekly for coordination. And the piece that's really important about that is because people are using this data, we believe it to be more accurate. So since we actually have our coordinated entry leads touching this data, using it for referrals, we get feedback immediately if something goes wrong. If we add a new program and the data isn't showing up, we get a call from the Human Services campus and says, hey, this program setup didn't come onto the by name list, what's going on? So we really do have a lot of accuracy behind the by name list from the coordination perspective, but we also generate the by name list on a monthly basis to be able to do data analysis and planning. On the left-hand side, it basically shows that we're able to track a person from their entire experience of homelessness, from when they enter the system and get added to a by name list, where they came from and what their what their situation was prior to homelessness, when they're actively in homelessness, and when they leave. So we can follow the whole process of a person, and we have this by subpopulation. So we have it not only for the entire system, but we have it for families, for youth, for veterans, for chronic, for unsheltered populations, et cetera. So when we do planning, we can then be able to kind of drill into some specific items. There were 3 particular goals that I was asked to share with this group to get feedback on. So I have 2 slides for each goal. I'm going to go through them real quick. And in them, it has opportunities for feedback and what specific feedback we're looking for. So the first goal, we'll go to the next slide. The first goal that we're looking at is very specifically reducing chronic homelessness by a designated percentage. So when you look at our inflow and outflow of chronic homelessness, it's actually relatively stable. We have an inflow of 470 on average persons entering our chronic homeless system, and an outflow of 466 individuals. And that's been pretty stable over the past year, which means that the housing resources that we currently have, we're doing around 100 placements per month. That's not sufficient to actually cause this number to go down. So in order to reduce chronic homelessness, this is a unit metric. So it's very specifically how many units would we need to add, what would our placement rate need to look like in order to reduce chronic homelessness. So if we go to the next slide, we get super in the weeds, and it has the projection. So if it says along the top here, if you wanted a reduction of 0%, well, at the bottom, we wouldn't add any additional units, right? We don't need to do anything. But if we wanted a 25% reduction in homelessness, we would then need an additional 250 units of permanent supportive housing. There are 2 specific areas that we're looking for feedback in around specifically chronic homelessness, and those are highlighted and labeled 1A and 1B. Basically, what reduction percentage do we aim for? When looking at regional strategies, cost is a real important factor in this. So saying that we want to reduce chronic homelessness by 100%, needing 900 additional units of PSH. That's a huge ask, right? That's not something that could be developed in a 6-month period. Even if we had 900 vouchers, would we actually be able to place 900 people in our current housing market, right? There's a lot of considerations to go into that. I'm going to go through the whole presentation and then we'll pause for comments. So we'll go to the next goal that we have listed. The next goal is a little bit more complex than the specific chronic homelessness. It's around reducing unsheltered homelessness. So in unsheltered homelessness, we have our current unsheltered by name list. This is currently listed as 1,100 people, 1,100 individuals. But we're seeing that on a month-by-month basis, this is growing. And this aligns with all of our experiences, right? That unsheltered homelessness is growing. So we're adding 37 people per month on average to that unsheltered by name list. And then importantly, Amy had the unsheltered numbers. Our point in time had a projected number of like 3,000 people, right? So there are a lot more people that are on the streets that are experiencing homelessness that are not touching our street outreach teams. So we do need to account for that. What percentage of people that are on the street are not getting served by street outreach teams. That's something that we have to include in this projection of actually decreasing unsheltered homelessness. So this one is a little bit more complex because the number, unlike chronic, is not staying stable. The number is going up, right? So we'll go ahead and go to the next slide. The very first column basically says that homelessness is increasing, unsheltered homelessness is increasing already. So if we had a baseline of no additional units, we're going to see an increase in unsheltered homelessness. And so if we wanted to just have things stay the same, so a reduction of 0% in that second column, if you follow that down all the way to the bottom, it's saying, well, we need a lot of additional units to be able to support just not having the problem continue to get worse. And, you know, unsheltered, this one's really complex. And so there's 4 different places where feedback would really be supportive. Understanding what type of reduction we'd be looking for, that coverage rate that I had talked about of what percentage of people are actually covered by street outreach teams. For this scenario, you know, thinking about current economic projections and, you know, are we going to experience increased unsheltered homelessness due to the moratoriums or economic conditions? And then last, this piece around moving people from an unsheltered location into a new location, this is where we start to have those conversations about additional shelter being needed. So when we say that we want to reduce unsheltered homelessness, an answer would just be providing shelter for everyone, right? That is not a good answer because it doesn't have the housing component to it. So trying to understand what is the right mix between the immediate need of getting people off of the street and into someplace safe, but also balancing that there's going to be additional housing resource needs. So there's 4 specific areas where we're looking for feedback in this. I would say particularly this last one, what percentage should be allocated between emergency shelter, rapid, and PSH would be the one that I would be most strongly interested in getting some substantive feedback on. The third goal and the third scenario, we'll go to the next slide, is really around addressing people that are entering homelessness due to the pandemic over this next year. So this is the space we've spent time talking about chronic homelessness, unsheltered homelessness. This is really the space where we're talking about new people that are entering the system for the first time. This is where we're talking about families. This is where we're talking about an opportunity to really change how we operate as a system. The conversation right now is around emphasizing prevention and diversion. Understanding that new people coming into the system are not chronically homeless from day one. People become chronically homeless over time. And so if we go to the next slide, the projection here is a lot more around looking at the people that are new to the system and predicting how that's going to look over the next year and how would we want our system to look different. So, you know, folks that have been at this committee for a while and seen presentations from TA providers, there have been a number of commentaries about the need to really build our prevention system and diversion system and make sure that it's better coordinated. This particular goal and the strategies associated with this goal would align with that idea. Really saying, let's front end some of our prevention and diversion conversations and those services to be able to cause reductions in this space. This is the only one where current availability, current placements really matter. Everything else, the housing placement rate is kind of baked into the total number of people that are actively homeless and are actively chronically homeless. Because this is a projection in the future, we do have to say, you know, what are the current resources and what percentage of people could we actually serve? So for this particular one, we're looking at what surge percentage should we model, looking at research and best practices there around what other communities are doing, and then also the resource allocation between the different needs. So at this point, that is the level of detail that we're going into to be able to look at these strategies and to put forth the projections. I hope that the presentation is at least showing that there's a lot of thought and a lot of intentionality going into this process. The intention was not to show all of the data, but to highlight a couple of the key points that are being used to drive the process. Before I turn it back to our chairs, I'll ask Amy if there's any other clarifications that we want to have before we leave it for discussion.
No, thanks so much, Ty. Really, really great work. We're excited to hear the feedback from the committee on the questions that Ty has indicated on the screen, as well as feedback on any other point of this work that you might like to offer. So Madam Chair, back to you.
Thank you. So now we'll just talk about comments and discussion from the members. It's you guys, Ty, you did a great job, and Amy did a great job as well. It's a little overwhelming, and there's a lot of work to be done.
There is, yes, and we're happy to. I think this should be on the MAG website already. If it's not, then we can make sure that it is there. And if you'd like to go back and look at the presentation after this meeting and really kind of dive into it a bit, please do feel free to reach out with any questions or comments as well. We understand that it is a lot of information, a lot of work has gone into it and is going into it still, but we understand that this is your first time seeing it. So want to allow for any kind of opportunities for feedback throughout this work.
Does anybody have any comments or questions?
Looks like we have a few.
Oh, okay, I'm not seeing that.
Oh, Wendy, I think your hand was up first, and then we'll go to Nikki and then Craig. Wendy?
Thank you. This is Wendy Johnson from Justice Center. I realize we have the data we have, but have we seen any modeling on those people who are experiencing homelessness, but not necessarily in HMIS? They're inactive, but they may still be here in the Valley. Do we have any idea of that kind of count and how we can estimate that? Because what I'm seeing is from the elderly is that they've never been down to the campus. So they're not in HMIS at all, but they are accessing services from several places, trying to get back into housing. The second source I'm using for that is the transient death list from Maricopa County and where they're dying. And a lot of them have never been on my list. So I'm concerned about how many more we really have and how that would, if that can be modeled in so we know what we're short.
Mm-hmm. No, thank you so much.
Amy and Tyler, unbelievable parsing down and making it Wendy friendly information. I appreciate that very much.
No, thank you. And Wendy, I need Ty to simplify it for me too. So, so you're in good company. No, and that's part of the art to dealing with really technical data like this is to simplify it so anyone can really access the data and contribute in a meaningful way. So that's very much part of this goal. Thank you. Ty, feel free to jump in. Wendy, I can take a first stab at the question in terms of how do we account for people who are not on the by name list. We are increasing the number in the model beyond what we have on the by name list. And so that is being validated and further expanded because we know that we don't have everybody on the by name list. We also know that we don't necessarily count everybody with the street count either and with the point in time count. So we understand that there will be gaps to this data and some limitations, and it is very important to keep those in mind. Ty, do you want to jump in as well?
I'm just going to ditto that. Specifically in goal number 2, we do have as a specific question. We identified that specifically for street outreach and for the unsheltered population that's something that we need feedback on. And Wendy, your ideas around particular data sources that we can look at to come up with what that percentage should be rather than just what my gut says or what anecdote says is really helpful. So those 2 data sources, particularly the transient death list, I have access to that information. It actually put into HMIS not for public view, but for analysis. And this would be the perfect use of data like that.
Perfect. Thank you very much, Ty. Thank you, Wendy. Nikki, and then we'll go on to Craig.
Hello, everyone. I also wanted to say thank you for the information. I do appreciate seeing the way the data is being looked at and analyzed, and that it's prompting these very important conversations regarding the larger strategy and areas of improvement and how we can help accomplish that and making sure that we're incorporating all perspectives. So thank you for the presentation. I do appreciate it. As far as the mix between shelter versus rapid rehousing and permanent supportive housing, my question and comment is around how much we are looking at the current rental market, how many units are available in the market, how many are projected to be available in the market with the new construction coming online, and what the gap is there. Because no matter how much funding we want to throw at permanent supportive housing or rapid rehousing, if we don't have the physical units to account for that, then that's not going to really matter right now. So I think that it's important to account for those construction timelines, how much our housing market rental units are going to become available, and then have that guide our strategy and maybe how we're phasing this in. Maybe up front it's heavier on emergency shelter if that is the type of space that we have available, but then it transitions as more units become online. I think that the other part of that is to point to Daniel's presentation before this presentation of the shared units, shared housing. If there is a timeline for implementing something like that and there's a significant uptake of clients looking to be in room sharing agreements, then that can possibly offset the amount of physical units that we would need to put individuals into either rapid rehousing or permanent supportive housing. So when I saw this presentation, those were just the things that were coming into my mind as I was thinking I would need more information on what that is to form a full decision of how I feel we should strategize. So I don't know if it's kind of a mix of a question and a comment, and I just, if you could let us know if that's already kind of being taken into account or how that would work.
Great. Thank you, Nikki, very much. Appreciate that feedback. Yes, we are definitely taking a look at the timing that's needed for all of these scenarios. Understanding that some interventions such as permanent supportive housing, for example, take significantly longer to put into place. And so even if we're working towards it, we're funding it, we won't have it tomorrow. And so we're taking that into account. Certainly, we can also take a look at the rental market and make sure that we're using appropriate costs in terms of the cost that is in part driven by the availability. Of course, landlords can charge more when there's less stock available, and that is very much part of the local analysis to make sure that we're using that local data and keeping it current and in line with that market. So thank you very much for those comments. Craig, I know something that you're here as well. Anything to add from your perspective as we develop these scenarios?
Yeah, I guess I've got three comments / questions. One is that since we're going to have a lot of new evictions, or we're assuming we will have a lot of new evictions, and Ty, you referenced the fact that those people would not be chronic homeless because they've been homeless for less than a year, and I think it would be nice if we didn't push people out to chronicity before we tried to help them. I guess the question really is, how is the by name list defined, and are there gaps in that definition which would allow us to say that, I don't know, a newly evicted person who had a job 6 months ago is now, can hit the by name list and get some rapid rehousing help? Is there any chance? I mean, am I flying afoul of various regulations when I say that?
Ty, do you want to jump on in?
Yeah, I think, so really specifically, the goal of the by name list is to show all persons that are actively homeless, not those that may be homeless in the future, but specifically those that are actively homeless. Now, I think that there would be an opportunity to say, in this current environment, we need to be looking upstream and to be able to really understand what our CAP offices, our community action agencies, what type of volume that they're seeing. We'll be presenting on it in a minute, but we're seeing 60 to 70% of our calls at 211 are for rental assistance and for eviction prevention purposes, and that's double what they've been historically. So this is a true need. I don't think it changes how we determine the by name list to say how many people are chronically homeless and need permanent supportive housing, or how many people are on the streets, right? Those methods really wouldn't change. It's that you would need to be looking at the upstream to see how are those going to change in the future? What surge are we projecting in each of these populations for increases? And in each of these models, specifically around trying to figure out the right amount of prevention, the right amount of diversion that is needed within the homeless system, that's where that surge percentage comes in. So both of these models, 2 out of the 3 models have very specific parameters by which we would say we're worried about the surge that is coming.
If I appreciate that. If the by name list is in fact a
Craig, you just went on mute.
I'm sorry. If the by name list is a priority list for housing, which I think it either is or generally is, we will be diversion is great and prevention is great, and we will still have an influx of people who are not chronically homeless, who I shouldn't say we will. I obviously hope we don't, but we may very well see an influx of people who are chronically homeless who will not qualify, as I understand it, in the current system for rapid rehousing funding. And if I'm wrong, tell me, but I just think that that's something in terms of, as we look downstream, as you put it, that we need to pay a little attention to.
Oh, you went on mute again, Craig. It's not us, I promise.
That's okay. I put my pad of paper on my keyboard and it hit the key. I think I finished my last point. I hope I did. The second thing is I'm a little concerned about the outreach number that we're quoting here. I've seen very little data which tells me that there is this is a qualitative judgment, but that there is that level of meaningful outreach that happens within the system right now. We all know outreach is really vital. The numbers I see out of in particular Phoenix Cares are, when and if they say 50%, it's a liberal 50% in terms of what services were actually provided. And I just wanted to, I guess, make that point and say, maybe if we disaggregated outreach data a little bit, we would see a better picture of how effective outreach is and where and how outreach can be effective. But I wanted to say that. The last thing is that I'd like to say is a little self-serving, hard to believe, but that the data that I've seen does in fact show, and this is related to the chart with the circles on it that you had, the data that I've seen does in fact show that shelter does improve a person's chance of remaining housed for the long term. And I just wanted to make that point because I do think shelter, it's going to be very hard, and again, looking downstream, to replace shelter beds with housing beds. I mean, there are techniques we can do to nibble around the edges. Nibble might be too strong a word, but there are things we can do to mitigate it. But it's going to be, I think, difficult. Well, put it this way: CAS is expanding by a couple hundred beds, and we're doing it in an 8-month window, and you couldn't build an apartment complex in 8 months. So I just want to, I guess, keep focusing downstream. Really is the thing I want to keep thinking about, because changes, I think, are in the air. And that's all I've got. Thank you, Madam Chair.
No, Craig, that's great. Thank you so much for commenting on that. I agree wholeheartedly. There's absolutely a constructive role for shelter. And while it's not the end outcome for anyone, it's a very necessary step for some folks who need that extra time and support to be able to be housing ready. And so I thank you for raising those issues. Want to be sensitive to time. I know Laura has a question as well. And if anyone else does, please let us know, and we'll be happy to take those comments to you. Laura?
First, thanks for all your work, Ty and Amy. I think the community is doing a lot of really vital work. I had a quick question though, Ty, on the Build Flexible Housing Pool to address people entering homelessness. My question is, it said 2020 new to the system, 6,600 individuals and 950 families. My question is, how many actual families came into the system as a whole, not just new, but returning? And the reason I'm asking the question is when we're talking about predicting the inflow after the moratorium ends, and this is more anecdotal, it seems like many of the families that we're getting referred are new families to the system, and many are new families who are new to Maricopa County. So I'm just curious, 220 new, how many total new and returning?
I can get that number for you, Laura. Off the top of my head, it's definitely less than half. It probably is closer to the 20 to 30% range of families that are brand new to the system that are coming into our shelters. The majority of families are that come onto a by name list are either returning from previous intervention or returning from housing. So the percentage of new is relatively from an overall perception that's pretty small. The idea though is from a diversion and prevention perspective, those are the families that are probably the most likely to have success in that particular intervention. And definitely when we look at that on the single side, that also is the place where we would have much more success than looking at people that are returning from other interventions that have been tried previously. So I do agree that number is smaller than like the total inflow, but I also believe that is probably if we're looking at targeting that intervention to a specific population, it would be those new families that I would be most inclined to target towards. But I'm very interested to hear additional feedback on that.
Well, the reason I'm bringing up the question, and I mean, I'll admit I'm old and I went through the economic recession when HPRP started, and I think it's great now that we have more resources for eviction prevention. And I do think we need to look more at eviction prevention and diversion to help with some of those families from preventing them from slipping back into the homeless system. So more flexible funding, I think, would be important. And that's just my 2 cents.
Mm-hmm. No, those are great comments, Laura. Thank you. We do that does touch on 2 of our goals out of the 14, or 2 of the strategies out of the 14. One of those is very specifically around flexible funding, and then the other one is around the eviction prevention and making sure that we're able to put those resources into place quickly. Absolutely. In just a moment, I'll see if Sapna has anything to add to this conversation or any questions. Want to pause for a moment and see if anyone else has any questions from the committee. Okay. Sapna, is there anything that you'd like to add?
Hi, thanks, Amy. No, what I wanted to just follow up on are some of the key questions that Ty posed that would be really helpful as these scenarios are developed. So what % reduction are we aiming for? What percentage of persons who are currently unsheltered, what percentage can we aim for? And what is the split in terms of emergency shelter, permanent supportive housing, and rapid rehousing that we should be modeling for? Because I think those will be driving what the projected costs will be. And all of this is, it's a dynamic process since we don't have enough, as Ty indicated, there aren't enough permanent supportive housing units to house the ideal percent. Ideally, we would be able to house everybody who's, for example, unsheltered. So I think there is a really important decision, calculation, scenario modeling element of this, which is what is realistic and what percentage, what is the assistance that's provided and the percentage split. I think that's an important question. I think it was in slide 5 of Ty's presentation. And I think that's what's to keep in mind and where we really would love to get the input of the community and experts.
Thank you very much, Sapna. Well said. Anyone have thoughts on that? So we hear that trying to reduce or proposing to reduce homelessness by 100% is not realistic or attainable necessarily. We definitely want to do something. So then we're somewhere between 0 and 100. I know the United Way has their goal out of reducing homelessness by 50%. So there's value in aligning with their goals as well. Anyone have any initial thoughts on that? If not, we'd welcome any thoughts that you might have after this meeting as well. Okay, maybe Brandy, if you don't mind sending out to the committee those questions that Sapna had just mentioned, and then so just to get that in front of everyone and to get your eyes on it again, if you could give some thought to it, and please do feel free to reach out with any thoughts or questions that you might have. Really appreciate your time today. Appreciate the opportunity to work with you and to learn from you and to be able to leverage your expertise as these regional efforts are being strengthened. That concludes our presentation. Madam Chair, back to you.
Thank you. And now we'll go on to agenda item number 6 with Stephanie. Thank you.
All right, next we get to hear from Ty again, along with Hillary Evans, and they will give an overview of a newly launched eviction prevention application.
Hi there, everyone. I'm going to get us started. So as Ty mentioned, the bulk of the calls that we've been getting at 211 have been related to housing needs, whether that's mostly it's been rental assistance, but also what to do around like legal notices that they receive from their landlord, or is there affordable housing that they can apply for, or is there shelter that they can go to? And so in response to that, we've worked with a number of providers. And Ty, I think you're going to share your screen. Is that correct? Yes. So one of the first tools that we created, or this is actually the most recent tool we created, is a landlord COVID-19 support packet. And this was a request we actually received from a number of constables that were going and working with tenants and not, and like mom and pop landlords and not really knowing how to support them and help them understand what the CARES Act moratorium is, and the CDC moratorium is, and then also what resources are available to their tenants and how they can support them in staying housed, but also in getting rent paid. So it goes over, as Ty's showing, these bullet points. It provides information on all of these different topics. And this came out of just different conversations we've had with a number of eviction prevention coalitions that have formed in Arizona over the last year, and what they would want to see in it. So we partnered with the Arizona Housing Coalition. We provided the resources since our 211 database has that, and but they're hosting it and have added to it some of their tools that they use. So that's one of our tools, and we'll put the link in the chat if that's something you would like to share with your agency or pass around. The other tool we started, and this one we did really quickly into the pandemic, and that was a rental assistance tracker, so to speak. And Ty, do you have that one?
I'm sorry, Hillary, I don't have that one pulled up.
Oh, okay. Okay, let me, that's okay. I'll just talk really quickly about it. So this one is also hosted by the Arizona Housing Coalition, and I will put that one into the chat as well. So what our team did here at 211 is we worked with the Housing Coalition to identify all of the incoming rental assistance programs that were related to COVID, and contacted each of them, asked them for their criteria, for how much they had available, how long they would have it available, anything about that. And then we have this massive kind of Excel spreadsheet with over 70 agencies that receive funding. And then we made that into a more, I guess, digestible form that the Housing Coalition keeps and updates. So our resource specialist team every other week contacts the agencies on this list to ensure that they still have funding, that they're still receiving applications, and asks if any of their criteria or any information has changed. And so then, oh, there it is. Thank you, Ty. And then Joanna over at the Housing Coalition updates this list. So just wanted to mention these two tools before Ty talks to you about the eviction prevention tool that we created. yeah, as you see, there's a lot of different programs on here. So please feel free to also pass this around and utilize it as you need. We find that there's the main programs that have been recently funded by the 25 billion that came out. And then there's also smaller programs that are still providing resources to communities. And this is broken up by counties. So you see on the left there, it has the county that it serves. So I'll turn it over to you, Ty, for the eviction prevention app.
All right, so just by way of introductions, so Hillary is my colleague at 211 Solari Crisis and Human Services. And I get to wear two hats. I get to wear the HMIS hat, and I also get to help with our 211 database and resources. Really excited to share two things that are going on with 211 right now. The first is that we launched a new website. So if you know 211 Arizona, for the past 10 years, it's been pretty antiquated and kind of painful to use. I would invite everyone to give it a new try. 211arizona.org, completely redesigned and redeveloped. And one of the features that's very relevant for this group is that we also built in a eviction prevention information app. So down at the bottom of the page, there's a chat icon where you can open the chat. Or if you're doing a search for housing and shelter, it will give you an opportunity to open the eviction app. When you open the app, it'll guide you through a series of 6 yes/no questions. And based off of how you respond to those yes or no questions, it will give you a customized report related to your individual situation. So as Hillary discussed on that page of rental assistance options, there's some that are available to those that are experiencing a financial hardship from COVID-19 and those that are not experiencing a COVID-19 financial hardship. If you've actually been served a notice or received eviction, you have different steps that you need to take. So I'll just go through the questions real quick. Are you experiencing a COVID-19 hardship? We'll say yes. Are you currently experiencing homelessness? We'll say no. Do you owe rent to your landlord? We'll say yes. Have you received a notice from your landlord of non-payment of rent? Let's say no. At the end of that, we do have a data collection piece where we're looking for zip codes, and we're able to do reporting on responses for people based off of their zip code. And at the end, you get a tailored report. So there are 23 individual tailored reports that come up. And with that, you get your specific issue with guidance on what to do. So it has information in this particular area. We said this is a person with a COVID hardship that owes rent, but does not have that immediate legal issue. They haven't been served a notice yet. So it outlines, here's what your current protections are. Here's what the moratorium guides you to do. And then very nicely, it gives you step-by-step guidance. So here is step 1 of what you need to do. Here is step 2 of what you need to do. We have the current links for all of the resources that we would send people to. Step 3 is contacting legal aid with individual hyperlinks. So again, if you were to respond a different item to any of those 6 yes/no questions, you'd be provided a different tailored report that you'd go to. This is a unique link, so the person can come back to it. You can download it as a PDF and use it. Our 211 call specialists are going through this chatbot with callers. So when a person calls, they get these 6 yes or no questions, and then they get emailed their individualized PDF. So very interested in this particular tool. We deployed it about 45 days ago. We've had over 2,000 people receive custom tailored reports, which is a pretty good number. And also I'll say that this app can be deployed on any other website. So we've had conversations about deploying it on other people's website, but you can also direct them to 211 Arizona. We are looking at making this text a little bit more bold when you come to the housing and shelter section, so you don't get immediately funneled into other areas. But we just launched our website this week, so making small refinements is still in process. So thank you so much for the opportunity to share this resource. Really excited about making tools like this more available because, again, we're only answering about 70% of the calls that are coming into 211 right now. And so we need more self-service options to be able to help people get their fingers on information that they need.
Thank you, Ty and Hillary. Are there any questions from committee members?
Hi, it's Laura Skotnicki. I just had a quick question. That's a great option. I think that's wonderful. I had a quick question about if it's available in Spanish or other languages.
Yep, so the chatbot is available in English and Spanish. Our website right now launched in an English only phase. We actually are going to be doing a full natural Spanish language translation of the 2-on-1 website. So it'll be there very shortly. If we need the link to the Spanish application, we have that separately. But just at this particular juncture, I don't have that publicized. I need to fix that though. So it's available in English and Spanish, and the 2-on-1 website is going to be full English and Spanish translated with then just Google Translate options for every other language.
Awesome. Great job, Ty.
Anyone else? Hearing none, so we will move on to our next agenda item.
Okay, thank you. So we're going to be talking about the item server as an overview of the learning and action and policy and partnership of the LAPP, which is the Learning and Action Policy and Partnership. And so Linda Jensen from the Arizona Coalition will be providing this presentation. So Linda.
Thank you. And I'm going to keep it very brief. I'll probably only use the first 3 slides, but I am here to deliver good news that we were recently awarded $100,000 from the Robert Wood Johnson Foundation for a data integration project. And we're calling it the LAP project. And you were right, it does stand for Learning and Action and Policy and Partnership. The administrative agency on the funding side is called DASH. So you may hear us talk about LAP, which refers to the grant. You may hear us talk about DASH, which is the group of people that we'll be working with. There are 4 other projects around the United States that were all awarded this $100,000 grant. And so nationwide, we're part of a cohort doing data integration. Next slide, please. Even though the Arizona Housing Coalition was the awardee, there are numerous grant partners, and the partnership includes 2 state agencies, Access and DES, as well as the 3 COCs and the HMIS administrators. Plus, we are fortunate to have HUD technical assistance. So the Arizona Housing Coalition will be acting as the administrative lead, and HUD TA will be acting as the technical lead. Next slide, please. So here's where this becomes really important to this group, because the problem we outlined in the proposal was a lack of aligned data among not only the 3 COCs, but also state agencies. And the solution that we proposed is a statewide HMIS data warehouse. And along with that warehouse, there would be consistent statewide care protocols that are informed by people with lived experience. And that's where, just to keep things brief, that's where I'm going to end today. But that's the important message that I want to leave you with, that this is a grant that is going to help us integrate data on a statewide level, and also to implement some consistent protocols across the state, so that not only is our HMIS data all together, but it will be integrated with Medicaid data to have a more holistic version of data that is surrounding an individual. So for each individual, we'll be able to see a more holistic picture of their care. And just for the sake of brevity, I am going to end there, but there is a lot more that we could share with you, and we will be continuing to come back and communicate with the different COCs. And I invite any questions that you have at this point.
Thank you, Linda. And I'm having a hard time with seeing people that have questions or raising their hands. So I don't know, Stephanie or Brandy, if you can help me.
Yes, I'm happy to help with that, Madam Chair. And I also wanted to mention that all of the presentations that were given today are on our website. And I know we have the chat disabled today, so those links that Hillary mentioned earlier, I would be happy to share those links in an email follow-up after this meeting today. Thank you.
Okay, so there's no questions?
I don't see any hands raised at this point.
Okay, thank you. So we'll go on to agenda item number 8, Stephanie.
Right, next agenda item is requests for future agenda items. Do any members have any items of interest for our June meeting? I know from earlier, we will talk again about shared housing with Daniel.
This is Ty with Solari. I would like to ask that with the shared housing conversation, if it's possible to bring forward items that are available for action, not only for information and discussion. I would appreciate that as a committee member.
Noted. Anything else from any other committee members?
I'm not sure if this is what Sai said, sorry, but just to discuss the shared housing, bring that back.
Yeah, that's what we were talking about.
Okay, sorry, I just was, thanks. Sorry about that.
Okay, I'm not hearing anything. So next agenda item.
Right. So announcements. Do members of the committee have any announcements to share? Okay. So I believe that, thank you. We can now adjourn the meeting. So thank you and have a great day. Thanks.
Thank you, everybody. Thank you to all the presenters. Great job.
Yes, thanks.
Thank you, co-chairs.